Hi, my name is Caitlin Duffner. I'm a third-year physical therapy student at Ohio State, and this is part 4 of a 6-part series called Bridging the Gap Between Physical Therapy and Adaptive Sports. The purpose of this project is to provide physical therapists and physical therapy students with an introduction to adaptive sports to better treat the wheelchair athlete. The first 3 videos included the introduction to adaptive sports and wheelchair basketball rules, classification, and biomechanics. This is part 4 and will include an introduction to pushroom wheelchair racing and classification. Objectives for this lecture include pushroom racing rules, learning the basics of pushroom racing classification, and to review racing wheelchair design and fit. So I want to start off by making clear the difference between a push rim wheelchair and a hand cycle. So on the left here, you see a push rim wheelchair, and on the right here, you see a hand cycle. So this image on the left, it's basically the wheelchair equivalent of running. It doesn't have any gears, and it's used for short and long distance races. So this athlete uses her hands and she's pushing on these rims here to propel the chair. For a hand cycle, it's kind of like the wheelchair of the equivalent of biking. And you have gears in a chain, and then you have handlebars here. And these are generally used for longer distance races. So we'll look at a quick video of the difference between the two. These two racers here in the black shirts are using push rim chairs. And then this athlete here in the orange is using a hand cycle. So as you can see, the athletes in black are using increased shoulder range of motion compared to the athlete in orange. They're also sitting crouched in their chairs with more hip flexion. You can also see their feet poking out the back here. So they're kind of in a kneeling position, and they're using repetitive impact on the rims in order to propel their chair forward. For the guy in orange who's using a hand cycle, you can see he's using a significantly less range of motion in his shoulders. It's also a much smoother stroke because his hands are attached to the bike at all times. And then he's sitting a little bit taller, and he's kneeling as well, but he's got less hip flexion. There's also another type of hand cycle that you can use completely lying down. So you're in a supine position, but that really just depends on athlete preference and trunk control. And so using a hand cycle is going to have a little bit decreased impact on the joints versus using a push rim cycle. So wheelchair racing is very similar to track. It's performed on a track. The distances are very similar. There's 3 sprints, the 100 meter, 200 meter, and 400 meter. There's a middle distance, which includes the 800 meter and the 1.5K. Long distance is the 5K and the 10K. There's a marathon, which is always performed on the road. And then there's also relays, which includes the 4x1, the 4x4, and the 800 meter medley. You have to wear a helmet at all times for all races. The time stops when your front axle, so this dot here, crosses the finish line. And there are also no batons used for relays. Passing of the baton looks like an athlete touching the other racer on the back. And once that athlete is touched, then they can move into the race. So there's a bunch of different classifications here. They're going to be a little bit more complex than the wheelchair basketball classification that we already looked at in a previous part. But there are 7 wheelchair racing classifications. They're kind of broken up into coordination impairments and musculoskeletal impairments. There are 20 ambulatory running and jumping classes. So these are athletes that are competing with or without their prosthesis. They might have impaired upper extremity or lower extremity function, and they might have intellectual or visual impairments. So we'll start off talking about the coordination impairment classifications. So these include class T32, T33, and T34. Common impairments in this class are hypertonia, ataxia, and athetosis. So common diagnosis in this class will be CP. For a T32 athlete, all 4 limbs are affected, and propulsion is difficult, and they usually have poor trunk control. For a T33 athlete, 3 to 4 limbs are affected. Propulsion is generally asymmetrical, so usually they have one upper extremity that has more function compared to the other side. And then they have limited trunk control. A T34 athlete usually has lower extremities more impaired than upper extremities, and propulsion is symmetrical, and they have near able-bodied grasp, and their trunk control is good. The other half of the classification system is for musculoskeletal impairments. So these impairments include limb deficiency, leg length discrepancy, impaired muscle power, and impaired passive range of motion. So these classes go from T51 to T54. T51 is going to be the most affected class. So they're going to have limited shoulder and elbow extension function. They're going to use elbow flexion for propulsion, and they're not going to have any sort of trunk control. A T52 athlete is basically an athlete that has no effective force applied with the wrist on the hand rim. So they're using their shoulder and elbow for propulsion, and they have anywhere from no to full trunk control. A T53 athlete is an athlete who has lower extremity and trunk affected, and they have full upper extremity function. So they use their full upper extremity for propulsion, and they have minimal trunk control. A T54 athlete is someone that has some lower extremity function. They might have some lower extremity function, but they are functional from the waist up. So they use their full upper extremity for propulsion, and they have anywhere from some to full trunk control. And these classifications have kind of evolved in the past 10 to 20 years. So this T52 class specifically, as time has gone on, has changed from mostly spinal cord, people with spinal cord injuries who have paraplegia or quadriplegia, sorry. So T52 used to be people with spinal cord injuries who had quadriplegia, and that has kind of evolved into more people with congenital disabilities that have some sort of upper extremity disability. So that kind of changes the whole class because they're people with congenital disabilities aren't gonna have the autonomic dysfunction that people with spinal cord injuries will have. So they can sweat below their lesion. They can also have proper blood pressure control, proper heart rate control, and so they won't have any sort of the autonomic dysfunctions that the T52 class is kind of used to seeing in their spinal cord injury individuals. And so it's kind of changed that way. They're working on making it a little bit more equitable in the classes here, but that is still yet to come. So racing design, you want to maximize aerodynamics and efficiency at sub-maximal velocity. So it's kind of hard to sprint in these chairs. They're a lot of the times built for sub-max movement. The chair wheels are 70 centimeters, and there's a 32 centimeter hand ring. Hand ring and wheel size can differ depending on how long the athlete's limbs are. So if they have long arms, they're going to have a larger hand ring because they can gain more access there, versus someone who has shorter arms, they're going to have a shorter hand ring and possibly shorter wheels because they can't reach as far. The front wheel is 50 centimeters, and the whole chair without someone in it weighs about 17 to 20 pounds. So the seat is called a cage. It's basically just a shelf that the athlete sits on in a kneeling position. Some athletes can be in a more seated position where their feet are out in front of them, or they can be like in the first video where you kind of saw that their feet were kind of behind them and they're in a more kneeling position. This compensator right here is a spring-loaded mechanism. The default position holds the front wheel straight, so the athlete can hit the compensator to then move the wheel, and then the compensator will maintain that wheel in a turned position. So the athlete can then push at the same time that the wheel is turned. So on a track, they can take that turn while they're pushing, which makes them a little bit more efficient. They can also use the steering lever here to push the chair, to steer the chair as well. That's going to be less efficient because you can only use one hand on the chair while the other hand is steering. There's also a brake here. You can kind of see the brake line there that will attach to the front wheel so you can brake. So wheelchair fit kind of depends on the ability of the athlete and how much trunk control they have. Like I said before, this T52 class can get a little bit confusing with, especially considering their diagnoses is a pretty wide range. So these are kind of like the classic T52 class. These men are both both people with spinal cord injuries who have quadriplegia. And so you can see that they have this huge dump angle here. So the angle between their trunk and their knees, you can see that their knees are much higher than their hips. And so they get a lot of passive support from the chair, versus this athlete down here who's a T54, who's much more parallel to the ground because he has that trunk control to keep him from falling forward out of the chair. He also has a reverse dump angle, so his hips are higher than his knees. And he also has active trunk flexion and extension to help with the push because he's a class T54, so he has some trunk control. So as you can see here, athletes in their chairs look very different. So you can see on the top, here's two T54s. They're very parallel with the ground. You can't really see their knees. They have a reverse dump angle. Here's some T53 athletes. And so to see this athlete here has a little bit shorter of a trunk, a little bit shorter of arms. So her wheel and actually her push ring are going to be a little bit shorter than this athlete here, who's a little bit more lanky than she is. And then when you come to the bottom, here's a few T52 athletes. And so this is kind of the typical person with spinal cord injury presentation. And so you can see how big of a dump angle they have and how much more they're sitting up versus these athletes up here who are much more parallel with the ground. And so athletes can use either soft gloves or solid gloves. Soft gloves are kind of the old school way of doing things. You can just buy them at the store. They have a few different sizes, but things have kind of evolved as the sport evolved. And so a lot of athletes will use these solid gloves, which are generally 3D printed with a more lightweight material. They can also be customized to the athlete's specific hand size. This is the back here. So there's some protection on the second and third digits, and then the thumb is encased here. And then here's the side that actually maintains contact with the wheelchair. And so you can kind of see here where these two worn spots are, where this athlete actually pushes on the rim of the wheelchair. And then they're covered in this like rubber material to kind of add some extra friction between the glove and the hand ring. A pilot study showed that racers who use these solid gloves on this side actually have less impulse when they hit the hand ring, and they propelled faster during sprints. So here's an example of an athlete who is class T53. So she's going to have minimal trunk movement. She has full upper extremity function, and she's also using solid gloves. So we'll watch here her pushing. So you can see that there's a lot of shoulder motion here. She's getting a significant amount of shoulder extension. And we'll actually go into the specific biomechanics and break down the cycle in the next video, but I thought I'd give you guys a little bit of a sneak peek of what we're going to be looking at. So this is kind of what it looks like. She's a T53 class, like I said before. It's difficult because she does have trunk control, but she's also rotted. She's fused from her surgery. So there's also that aspect of she has trunk control, but if she can't use it, then would she be a T54? Would she be a T53? She was actually classified as a T53. So there is some subjectivity there. There are athletes with similar injuries who are also rotted, but because they technically have muscle activation, then they were moved up to the T54 category. So it does get a little bit confusing with these classifications. It's not the easiest thing. And then here are some resources. There's two videos of the Paralympics races down here. The classification manual is at the top. That was super helpful. It goes in depth to all of the classifications that you could ever imagine. There's a bunch of them for track and field. This is a commentary for a men's 1500-meter race. It's kind of cool because you get to see the perspective of the racer as he's going. He's wearing like a GoPro. So that one was kind of cool. And then there's a Q&A and a breakdown of wheelchair parts. So here are my references. The next video will include wheelchair racing biomechanics, and we're kind of break down the push cycle. So feel free to stick around for that.